Okay. Should I start introductions? Okay, Amy is nodding. That's a great sign. Well, good afternoon and welcome. My name is Carrie Raystian, and I'm an associate professor of public policy here at UConn. Along with Professors Mary Bernstein and Jennifer Deneen, I co-direct InCHIP's Gun Violence Prevention Research Interest Group. So on behalf of the RIG and on behalf of InCHIP, it's my pleasure to introduce Dr. Matthew Miller to you. Dr. Miller is a professor of health sciences and epidemiology at Northeastern University, an adjunct professor of epidemiology at the Harvard School of Public Health, and co-director of the Harvard Injury Control Research Center. He is an expert in injury and violence prevention. His 200-plus publications have advanced the field of gun prevention scholarship in a number of ways. He's produced work related to firearm storage in children, veteran suicide, the role of legal policies in gun death and injury prevention, and he's also produced scholarship related to the role of physicians in reducing firearm-related injury and death. His expertise has also been used to inform policy conversations. He has consulted with the Vice Chief of Staff to the U.S. Army, the National Strategy for Suicide Prevention Task Force, the Commonwealth of Massachusetts, to name but a few. I could go on, but I will stop there because he has a fantastic presentation for us. A quick note on logistics, please feel free to pop your questions into the chat and then I can moderate those in the last 15 minutes. We'll have Q&A. We'll hope that's more conversational, but of course, if for some reason you would like me to read your question, please just put that in the chat. Dr. Miller, we are simply delighted to welcome you here to UConn, virtually, but here nonetheless. And of course, thank you to everyone for joining us today. Dr. Miller, I'll turn it over to you.
Well, thanks so much for that generous introduction and for the opportunity to speak today at your forum. So without sort of further ado, what I'm going to talk about today is the relationship between firearms and suicide, present some of the overarching literature, and then talk about some of the recent studies that I've done with members of my team. What you see on this first slide is a picture of a young man standing on the cord at the Golden Gate Bridge, thinking about whether he's going to jump or not. And the question that comes up when you're talking about preventing suicide by making it impossible for people to jump from the Golden Gate Bridge by putting up a foolproof barrier on the Golden Gate Bridge, for example, is whether in the absence of being able to jump from the Golden Gate Bridge, would somebody find an equally lethal way to take their life? Would they attempt at all? And if so, with what, and with what likelihood of death? The likelihood of dying if you jump from the Golden Gate Bridge is over 90%. It's similar, in fact, to the likelihood that you would die if you use a gun in a suicide attempt. You rarely get a second chance with either of those methods. And so another way of thinking about this question, which will gurgle beneath the surface of today's talk, is whether suicidal intent is all that matters, or whether the ready availability of highly lethal and sort of culturally acceptable methods also plays a causal role in determining the likelihood of a given individual's death and the population level suicide rates. So here's a slide that shows you the leading causes of death in the United States in 2019, the last year for which we have sort of full statistics. I'll show you a slide, tentative statistics for 2020. But as you can see in this last column, suicide is the 10th leading cause of death in the United States. It exceeds the number of deaths from homicides, for example, and has consistently been among the 10 leading causes of death for decades. Among younger people, you can see that is the second leading cause of death, exceeding the number of deaths from homicide in the younger age groups. Okay. That's all I want to say here. And then to step back and talk about the number of suicides and the methods involved. So in 2019, there were over 47,000 suicides. Half of those involved firearms, almost 24,000. So you can't really talk about trying to prevent suicide in the United States without talking about preventing firearm suicides. It was the 10th leading cause of death overall, as mentioned, second leading cause of death among people under 35, and the second leading cause of death among children. In 2019, just to give you some contrast, there were 19,000 homicides, 14,000 by guns. So there were 10,000 more gun suicides in 2019 than there were gun homicides. That's something that most people sort of don't appreciate. There are more gun suicides than gun homicides. Of all the gun deaths in the United States, about 60% to 2/3 are gun suicides. Preventing gun violence in the United States means paying attention to suicide, just as preventing suicide means paying attention to the role of firearms. Provisional data from 2020, which I'll show you on the next page, suggests that suicide rates actually declined by about 5 or 6%, down to 45,000. And here's a slide showing the leading causes of death over the past 6 years, 2015 to 2020, where there's a row for COVID in 2020. Had it not been for COVID, suicide would have been the 10th leading cause of death. COVID pushed it down to number 11. And it gives you a sense of where suicide stands relative to some of the other leading causes of death, as did the overall slide. So what we have here is a somewhat blurry picture of the United States and a maybe less blurred picture of a sign talking about the number of people who die by gun suicide. The sign's a bit old, but suicides, there have been scores of people dying by suicide by gun year after year after year in the United States. And what I want to draw your attention to, in addition to this being blurry, is that there are parts of the United States, this red swath in the mountain states, where the suicide rate is 3 to 4 times higher than in other areas like the Northeast where we live. This variation, a 3 to 4-fold variation in death by suicide, is more variation than for any other leading cause of death. Look at the other 10 leading causes of death, nothing varies remotely as much as suicide does from state to state. What could be accounting for this? When I give these lectures, for example, in psychiatric grand rounds, and I ask this question, the responses that I get are, well, there must be much higher rates of major depressive disorder or substance abuse disorder or other well-established psychiatric risk factors for suicide in the places that are colored red than in the places that are colored blue. That turned out not to be the case. The rates of suicidal behavior, the rates of serious psychological distress, the rates of major depressive disorder, the rates at which people think about killing themselves, and the rates at which people actually try to kill themselves are really no higher in the high suicide states than in the low suicide states. What this graph shows you is it plots at the state level, 50 states, going from the states with the lowest suicide rate, like New York, Massachusetts, Connecticut, right here, up and up and up in rank order until you get to the states like Montana, Nevada, Alaska with the highest suicide rates. But the rate of psychological distress, major depressive disorder, suicidal behavior, it pretty much doesn't vary from state to state. It's just noise. So how can suicide rates vary 3+ fold when the major underlying psychiatric risk factors really show no relationship to the overall suicide rate? How can that be? Does that make sense? And what sort of ties these together is when you separate out gun suicide rates from non-gun suicide rates. Okay. And so what we have here, this is just a histogram showing you exactly that upper line in the previous graph. And what you can see is this contour going from states like New York, Massachusetts, and Connecticut with relatively low suicide rates, the height of the aggregate area, to the states with the highest suicide rates. What you see changing is not this blue area so much, the non-gun suicide rates, but the orange area, which represents the firearm suicide rate. So what distinguishes low overall suicide states from high overall suicide states is that high overall suicide states have much higher gun suicides, with non-gun suicides not being all that different from the state that have lower suicide rates. Well, not surprising, the rates of high gun suicides occur in states that, guess what, have lots of household gun ownership, where rates of household gun ownership are higher. And let me show you this, and I'll reverse the slides in a second. So what I just said is that in the states where gun ownership is higher, you have higher rates of firearm suicide. That's what this scatter plot is supposed to show you. If you just step back, what you can see are two very strong correlations: this purple graph and this blue graph, with this green graph showing not much of a relationship at all. Well, with this, the x-axis in all of these graphs is household firearm prevalence, the proportion of households in a given state that contain guns. On the y-axis, you have deaths per 100,000, the rate of death by suicide. This is the rate of death by gun suicide, a very strong correlation. More guns, more firearm suicides. This is the relationship between household firearm prevalence and non-firearm suicides. Not much of a relationship, just as the blue area in the previous graph showed you. You combine this pink and the green, gun plus non-gun suicides, to get total suicides, and this is a visual illustration of the correlation between household firearm prevalence and overall suicide rates. It's very strong. And remember, the states that have higher gun levels don't have higher rates of suicidal behavior or major depressive disorder. They just have more people who die in an attempt because it's easier to reach for a gun and you don't get a second chance with a gun. So now I'm going to go to the previous slide, if I can, and just say that that doesn't mean that mental illness, substance abuse, psychiatric risk factors of any kind, childhood experiences, adverse childhood effects, genetics, other environmental influences, et cetera, that they don't play a key role in producing suicidal thoughts or in getting people to a point where the only out they see is a suicide, an attempted suicide. They are strong risk factors at the individual level for dying by suicide and for making an attempt. But what determines whether at the population level you have higher death rates is the likelihood that an attempt will lead to suicide. That's true for an individual, and that's true at the population level. And what we're going to focus on today is not all of the very well-established risk factors for suicidal behavior, but rather, what is it that's responsible for the transition from an attempt to a death? What proportion of attempts end up resulting in a death, and what determines sort of that likelihood? Okay. This is just another illustration on a smaller scale of the scatter plot that I just showed you at the national level. These are data that my colleagues David Hemingway, Deb Israel, and I put together years ago, in which we got information from the states in the Northeast, other than New York, because they didn't send it, about the number of suicides in their states, number of firearm suicides, number of non-firearm suicides, and the household firearm ownership level using the BRFSS data. What we found was that in states like Vermont and Maine, which have relatively high firearm ownership rates compared to Massachusetts, New Jersey, and Rhode Island. You had higher overall suicide rates because the rate of gun suicide was higher. If you look in this last column, you see non-firearm suicide rates. They don't vary very much from state to state, but the gun suicide rate is strongly correlated, as you can see, with the percentage of households with firearms. You add the non-gun to the gun suicides to get the total suicides, and you can see that there's almost a twofold difference within the Northeast in overall suicide rates that's driven entirely by the differences in firearm suicide rates. Okay, so I will stop belaboring that point, but it's an important one. Here's a study by colleagues of mine, Kathy Barber, Richard White, who was a graduate student at the time, and Deb Azriel, in which we looked at the 50 states and to give a sense of how many more deaths there are in high gun compared to low gun states, we grouped the states together based on household gun ownership, from the states with the lowest household gun ownership to the next lowest, to the next lowest, to the next lowest. So New York, Massachusetts, we got to Connecticut, and we grouped them together until we had an aggregate number of people living in those states that was equal to a group formed by starting with the highest gun ownership state, and then take the next highest, the next highest. And so we compared the states with the highest to the lowest gun ownership. And what you can see here for the high gun ownership states, there were, because it's 2 years, 62 million person years of information, 31 million people in those states. In the low gun states, just about exactly the same number of people, right? Can you see my cursor moving? Okay, so you can see that I'm showing you in the high gun ownership states, there's 62 million person years of data. In the low gun states, so same basic number of people. In the high gun states, there's 7,275 gun suicides. In the low gun states, there are only 1,700 over these 2 years. Non-firearm suicides, 4153, 4341, no difference. A difference of 5,000 people dying in the high gun compared to the low gun states, driven by differences in firearm suicide rates, where the suicide attempt rate was no different, 41% compared to 49%. Even slightly higher, in fact, the low gun states. And so the ready availability of guns in the home leads people who make attempts at the same rate to die at much higher rates when they reach for a gun compared to when they reach for other suicide methods. Okay, let's see. So why might reducing access to firearms or other highly lethal methods actually save lives? Why do we see these great discrepancies cross-sectionally, which are also seen in individual level studies, case control studies, cohort studies, which I'll get to? But what's the rationale for trying to save lives, prevent suicide by restricting access to guns? Well, the first well-established clinical observation is that many suicidal acts, many suicide attempts are actually impulsive and in response to crises that are fleeting. The second is that the method people choose depends on how easy it is to gain access to that method in a vulnerable moment during a crisis. The third is that the method you choose largely determines whether you live or die. The case fatality ratio, the proportion of attempts with guns that prove lethal, 90%. The proportion of attempts with pills or cutting that prove lethal, less than 5%. It's a big difference if you substitute a gun for a pill. If you substitute a pill for a gun because a gun's not there. And then sort of this last observation is that fewer than 10% of people who have survived suicide attempts go on to kill themselves thereafter. And why is that important? Why is it important to know that if somebody has tried to kill themselves but they've survived, that their chance of dying by suicide is actually less than 10%? The reason that's important is that if you can save someone's life today by making it hard for them to reach a gun, instead they cut their wrists or they take pills or they don't attempt, the chances that that you have saved them in the long run are pretty high. So preventing someone killing themselves today because you make it harder for them to reach for a gun. Even if they make an attempt with pills, or cutting, or something else, the chances that they will go on to die thereafter sort of drops to less than 10%. Whereas if they had reached for a gun, the likelihood they would have died is 90%. That's the main point. Okay, so here are a few slides just to give you some of the evidence supporting these contentions. This is a study of younger people, 15 to 34-year-olds, who were admitted to a hospital in Houston after a nearly lethal suicide attempt. And after they were medically stabilized, the researchers spoke with them and asked them, how long did it take between the time that you said, that's it, I'm going to take my life, I'm going to kill myself, and the act itself that landed you in the hospital? How long did it take between the time you said, that's it, and the act itself? Well, for a quarter of all people, it was less than 5 minutes. For half, it was less than 20 minutes. And for 70%, it was less than an hour. They acted shortly after they had made the decision. And so what was readily available to them really mattered. This is a busy slide. And the point here is that if you speak to people who have overdosed in Sri Lanka, for example, on pesticides, or in the UK on medicines, and you ask them, why did you use what you used? The great majority will say, it was just really easy. It was there. It was easy for me to put my hands on. And if you then ask them, what did they think the result of that attempt would be? Most of them say, I expected it to kill me. And when you speak to these people who survived and you ask them these questions, you get a sense of why people chose the methods that they chose. And in Sri Lanka, where you could speak to people who were going to die, but hadn't yet, the reasons they gave for choosing the pesticide that they did was the same as the people who survived. It was there, and that's what was easiest to put my hands on. So here's a study by a former undergraduate student of mine at Northeastern, Andrew Connor, who's now a medical student at Quinnipiac. And he's been incredibly prolific writing about firearm violence, and it's going to be a real superstar someday in this area. Anyway, what he did is he took vital statistics data on over 300,000 suicides and linked them to emergency department and inpatient gun data to come up with sort of a pretty comprehensive, the most comprehensive study looking at the likelihood of death to case fatality ratio for different methods. And here's just a summary slide for you. 90% of attempts with guns prove lethal, 50-ish percent by hanging, 30% by jumping, less than 2% by poisoning, less than 2% by cutting, less than 2% is among the methods, this last row, among the methods that by far and away are the ones that are most likely to be used in suicide attempts. Okay. Here's a slide that shows you some more data in the paper. Overall, the case fatality rate for suicidal behavior in the United States, 9%. It made a difference. Men, 15%, women, 3.5%. And the older you are, the more likely an attempt is going to prove fatal. If you're a teenager, the likelihood an attempt proves fatal is under 5%. If you're over 65, the likelihood is closer to 40%. But what that gradient really speaks to, when you parse things out by method, is that younger people tend to use cutting and pills more, and older people tend to use more lethal methods like hanging and guns. If we look by method, this last section of the table, you can see, if you look at firearms, that 90% of firearm attempts prove fatal, whereas looking at the most commonly used methods, drug, poisoning, 2%, and cutting, even less. Okay. So we talked about this, the 10% of fewer than 10% of people who survive go on to die. So what do we know about the guns that are used in suicides? Well, we know, and I've reviewed with you already, that they're the most lethal commonly used method. in the US. The vast majority of guns for adults and for kids come from the decedent's home. About 3/4 of the guns used in suicides are handguns overall. But when it comes to youth, especially youth living in rural areas, long guns play an equally large role. About half of all rural youth suicides involve long guns. Most of the guns that are used are not purchased with the intention of using that gun in the near future to take one's life. Most of the guns are purchased and have been in the house for years and years. In the few studies that have looked at that, in Arthur Kellerman's case control study, where they looked at all the suicides in two major cities, only 3% of the guns that were used in those suicides had been purchased over the previous 2 weeks. We know that there are lots of guns in the United States, over 300 million in civilian hands. How those guns are distributed really matters. Household gun ownership matters. About 1/3 to 40% of households today contain firearms. And there are over 5 million children today who live in homes not only where there are guns, about 1/3 of all children live in homes with guns, 1/3. But there are over 5 million who live in homes where the guns are loaded and unlocked, at least one loaded and unlocked gun. And at the individual level, just as I told you, at the ecologic level, gun owners and members of people who live in households with guns are no more suicidal. They don't have higher risk factors for suicide. They're not more depressed. They don't think about suicide more. They don't have more substance abuse. There are no suicide risk factors other than living in a home with a gun that distinguishes people who live in homes with guns from people who live in homes without guns. Okay. It's the guns that are responsible for the much higher suicide rates among people who live in homes with guns. We've kind of covered this already. So there are more than a dozen US case control studies summarized in a nice meta-analysis by Engelmeyer and colleagues, in which they controlled for various factors in these different studies to come up. And in this meta-analysis, after sort of summarizing the information, Engelmeyer said that household gun ownership is associated with a more than 3-fold increased risk of suicide, meaning if you lived in a home with guns, the odds of dying by suicide for the people in that home, the men, the women, the children, was 3 times higher than the risk in homes where people lived in homes without guns. The odds ratio is threefold higher. Let's move on. So the evidence I just mentioned comes from over a dozen case control studies. We've talked a little about some of the ecologic studies. There are 2 cohort studies that have been done. One back in 1909 by Garen Wintemute, and then 21 years later by David Studdert, on which I've had the pleasure of working, along with Dr. Wintemute, who is also part of this 2020 study. I'm going to tell you a little bit about this study now. So this is a cohort study in which compared people who were gun owners based on information from essentially a gun registry to people who were not gun owners. And it followed tens of millions of people over a 12-year period, those who were gun owners and compared them to those who weren't gun owners, and looked to see what the rate of suicide was among those 2 cohorts. And it was published in the New England Journal last year. It took over a year and a half to link the mortality data to the gun registry data to create this cohort, which would then enable us to follow these people over time in order to know more about who they were and to track them. We also to have their addresses to link to the gun registry data. We also link to the voter registry information. So the people in this cohort are all actively within the voter registry files, as well as living in California. So there were, as I said, almost 29 million people who were followed for up to 12 years. And over 1 million of these people bought their first handgun during that follow-up period. Over 1.6 million died, 14,000 from gunshot wounds. And the information that we had about these members of the cohort include what's on the bottom of the slide, age, sex, race, residence, we had time varying measures of that from the voter files, dates that they bought a handgun, and dates that they divested from all their handguns on an infrequent event, and area level measures of socioeconomic status and other things. So here is the cohort of 29 million people, the gun owners and the non-gun owners, just showing you the sample characteristics of the two groups. You'll note that gun owners tended to be more white than the non-gun owners, and more likely to be male, and a little less likely to live in urban areas. And we could account for all of that in the analyses. So here's the table with the results. When you look at the, if you look at first the suicide rate, in the group of gun owners, the suicide rate overall was 47 per 100,000 compared to 9 per 100,000 in the non-gun owners. The adjusted hazards ratio is almost fourfold higher. So essentially the risk of suicide, the rate at which people who own guns died, was 4 times higher among people who own guns than among people who did not own guns. When you look at the suicide by firearm, overall, it was 9 times higher, 9.08. That's the hazards ratio for suicide by firearms, whereas the rate of suicide by other methods, 0.68, was actually a little bit lower. What's really striking here as well and highlighted is that women gun owners had a overall suicide rate that was 7 times higher than women non-gun owners, driven by a firearm suicide rate that was 35 times higher. So I think we've sort of covered that. The take-home findings here: handgun owners had nearly 4 times higher rate of dying by suicide than non-gun owners after having adjusted for the various things in the model, driven by a 9-fold increase in the risk of firearm suicide, where the risk of non-firearm suicide was fairly similar in those who were gun owners compared to non-gun owners. And there was a very high risk period immediately after the purchase for some of the gun owners, but the vast majority of gun owners who killed themselves more than a month after their purchase. Sort of the take-home message, consistent with the case control studies and the ecologic data, is that handgun ownership involves a substantial and an enduring risk of suicide. Okay, here's another study that I want to talk with you about. It's a study by a wonderful young researcher, Carmel Solly, who's at Northeastern, and my longtime colleague, Deb Azriel, also a fantastic researcher. And in this study, which came out in JAMA Network Open this past year, we looked at how easy it was for adolescents to gain access to loaded guns in their home, and whether their parents felt that their children could gain easy access, whether their parents were contradicted by their child's report, and so that's what I'm going to talk to you about now. So just some background: storing guns loaded or unlocked is a risk factor for youth suicide. And in fact, if you look at some older studies like that of David Grossman, firearm suicide rates are 3 times higher if a youth lived in a gun-owning home where the gun was unlocked, compared to youth living in a gun-owning home where all the guns are locked. It puts kids at risk when guns are unlocked, and it puts kids at risk when guns are unloaded. But just because your gun is locked up doesn't mean your kid can't get to it, and that's one of the things that we wanted to explore here. I'm going to go to the next slide for the sake of time. So what did we do? This study used a nationally representative sample of parents and their 13 to 17-year-old children, all of whom lived in gun-owning homes. We spoke both to the parents and to their children. It was a dyadic study, not on average what do parents think, on average what do kids say, but no, we had parents and their children, and we could ask them separately questions about their child's access and explore sort of the concordance and the discordance in those answers, as well as the descriptive statistics that came out of it. This survey, the 2019 National Firearm Survey, was a probability-based survey that was sort of nationally representative. I'm happy to talk to you all about sort of the response rates and the weights and whatnot in the discussion section, but I'm going to skip over for the sake of time so I can show you some of the results. We had 4,000 adults living in homes with guns, 2,900 owned the guns themselves, and several hundred parents of these adolescents who agreed to participate. So what did we ask? Adolescents in these gun-owning homes were asked how long it would take to get to a loaded household gun, or to a household gun and load it if it wasn't already loaded. So not just get to a gun, but get to a gun that was loaded, so they could shoot it if they wanted or needed to. And we gave them 4 choices: less than 5 minutes, under an hour, under 2 hours, but more than an hour, and I couldn't get to it in less than 2 hours. Parents were asked, as far as you know, can your child, the child taking the survey, access any of the guns in your home independently, that is without you or another adult in your house accessing it for him or her? And we also knew information about the total number of household guns, what types of guns they were, how they were stored, elicited from parents who owned guns. And so what did we find? Well, there were 318 dyadic pairs. The adolescents were on average 15 years old. Parents were about 45. A little more than half of the adolescents were male, and about half of the parents were male. On average, there were 6.4 guns in these gun-owning homes. Half of them had unlocked guns, half of them had loaded guns, and that gives you a sense of, and that's not all that different from other surveys. Okay, here's what adolescents told us about how easy it was for them to gain access to guns. For adolescents overall, a third, 33.9, a third said, I could get to a loaded gun in less than 5 minutes, a third. And an additional 17%, so 50%, half of all kids could get to a gun in their home, a loaded gun in their home, in less than an hour. A third could get to a loaded gun in their home in less than 5 minutes. The number of guns, the more guns you had, the more likely it was your adolescents said they could get to it quickly. How about storage? If you had an unlocked gun, instead of a third, it was 45% of kids who said I could get to it in less than 5 minutes. But even for parents who said, no, none of my guns, not any gun, none of my guns are locked or unlocked, all are locked up, still a quarter of kids said I could get to it. And I'm going to go to the next slide. Now, this is a graph of what parents said about whether their child could gain independent access to a gun in their home. Overall, this what we call the full sample, 28%, so almost a third, 28% of parents said, yes, my kid can gain access to a loaded gun, sort of implying that that's cool with them. 70% said no. 30% said yes. If you go down to this row here, for parents who had lots of guns, it was half. Half said, yeah, my kid can get to a loaded gun independently. if they had lots of guns. And when people have lots of guns, they're more likely to have unlocked guns. Among parents who had unlocked guns, 50% said, yeah, my kid can get to it. So a lot of parents say it's okay and seem to endorse that's okay. When parents lived in homes where they locked all their guns, 13% said that they thought their kid could get to it. So far fewer. So locking kind of predicts in some ways what parents are going to say about their child's access. To what extent does it predict, in truth, sort of whether their children can gain access? Well, that's the next table here, comparing parents' report of their child's access to what the child himself or herself said. So, okay. Parents' report of adolescents to a household gun. Among the 70% who said no, that's this column here, 22% were contradicted by their child's report. And at 22% of their children said, I could get to it in 5 minutes, and 15% said they could get to it within another 15 within an hour. So 46% of kids said they could get to a loaded gun within an hour, and their parents said, no, that my child can't gain access to it. No, they can't. And fully 20% could do so in less than 5 minutes. So that's sort of the measure of discordance. So in summary, like 1/3 of adolescents could gain access in less than 5 minutes overall, and 1/2 in less than an hour. Locking reduced the likelihood that the adolescent would say that they could gain access, but even when all guns were locked up in the home, per the gun-owning parents' report, 1/4 of all children said that they could get to a gun in less than 5 minutes. Locking it up, even among those who said, no, they can't get to it, doesn't mean your child can't gain access to it. And that's a really important message in terms of what we have to emphasize. It's not whether you lock it or not. It's whether your child has access or not. And the other point is that 30% of parents sort of acknowledge that their child can, in fact, gain access to a loaded gun in their home independently. And the point, as I mentioned, is that the public health and clinical focus needs to be on access, of which storage is only a part. Okay. I'm sort of mindful of the time, and so I'm going to just present one other paper by Andrew Connor, but I'm going to jump to the results. This is a paper, again, from the same survey, so I don't have to describe the methods to you, but it doesn't involve the dyadic sample, in which we asked people who live in gun-owning homes how often they've been spoken to by clinicians about gun safety. And I'm going to skip over all of this. Here's the main result. 7.5% of adults living in homes with guns said that they had ever been spoken to about firearm safety by a clinical provider, by a doctor, a nurse, or some other clinician. If you had kids in the home, it was a little bit higher, 12%, 1 in 7-ish. If you didn't have kids in the home, it's more like 1 in 20. And it didn't matter whether the gun owner or the person you were speaking to was male or female, black or white, married or not married. You had these pretty low reports, no matter who you spoke to. Most of the encounters occurred in outpatient clinics. 12.5% were in the ED. Remember, there are not that many, but of those 7.5% that did occur, we asked, well, where were they? Most were in outpatient clinics, 12% in EDs, and most of them occurred when the respondent was the patient. When the respondent was a patient, 30% occurred when a child was the patient, and 13% when another adult was a patient. What was discussed when the respondent was the patient? Well, about half the time they talked about storing guns locked, and about 1/4 of the time they talked about getting the guns out of the home when the respondent was the patient. When another adult was a patient, 2/3 talked about locking and a little more than half about removing. And when a child was the patient, 3/4 of the time, storage was talked about. Only 4% talked about removing the guns from the home. Only 4% talked about removing guns from the home when a child was the patient. And we know that locking the guns helps, but we also know that locking the guns is not a foolproof way of reducing access. All right. So I'm going to stop there because I know that we were supposed to leave 15 minutes, but it's better to leave 14, which is what I think I've left. And if you want to know why I have this picture up here, you can ask me. So I hope that was that stimulated some questions. And if not, I can continue to assault you with data. You're muted if you're.
Perfect. Okay, I was locked from being able to unmute myself a second ago. We have very good tech people in the back keeping us on track. So, thank you. That was fascinating. I have promised in the chat the first question to Erin Adams. So, Erin, if you are able to unmute, go for it. If not, I will read your question.
Can you hear me?
Yes.
Yes, we can.
Awesome. I have actually 2 questions. I'll ask the first one, and if there's time, I can ask the second one. They're both in the chat. So the first question was, I'm a geographer who's actually being asked to do research involving guns and suicide. So these are related to my research. So I was just wondering, so when comparing state statistics, major population centers can often skew the results. So areas, the states that have Los Angeles and New York City are hard to compare to Wyoming and West Virginia. Have you found similar results when you look at county or census tract level? The reason is I want to know, are the rural parts of California similar to rural areas in Wyoming, or is this a trend that's general to all of California?
Well, the California data that I showed you are individual level data. Those are the from the cohort study that was, we had gun ownership measures. We also knew where they lived, but we didn't do a rural to urban cross-sectional comparison. We just followed people, and at the census tract level, we could adjust. We could match essentially. We had people who were living in a census tract, which is a pretty small geographic area, and who own guns, and people who lived in the census tract who didn't own guns. The ecologic studies that I showed you were just sort of state level measures. There's another study that we did looking at cities in which we compared sort of city to city based on gun ownership levels in those cities using a proxy for gun ownership, and found basically the same sort of relationship that we found in the cross-sectional data that was most simply displayed in the Northeast state slide.
Thank you.
Okay. If you have other questions about like your research that's specific to the information on gun ownership, you can email me and I can probably try to answer them in more detail.
Thank you. I'm just looking for variables, really, for the explanatory variables. Thank you.
Okay, because we're measuring gun ownership. We haven't measured gun ownership at even the state level with direct measures, survey-based measures, since 2004. There are no good state level measures, survey-based measures in the past 20 years. There are proxies people use, and some of them may be problematic. But if what you're measuring is gun ownership at in more recent times at area levels, you need to be careful about sort of how you're measuring that. Lots of people have used surveys that are not appropriate for even state level aggregate measures of gun ownership and tried to publish results. I'm going to shut my window because of the garbage truck. Okay.
The joys of presenting from home.
Yeah.
I think our next question is from Dr. Deneen. Jen Deneen, do you want to unmute?
Sure, thank you. Thank you very much, Dr. Miller, for both of those papers. My question list kept growing as you continued, but I think there's a common theme among my question, and I'm wondering if you've had the opportunity to look at the role that social or political context or measure any of those variables might play in both pieces of work. So in the early work, the slide that you presented, I think from your 2013 paper that looks at suicide rates among low ownership states and high ownership states, I was wondering if you had the opportunity to look at moderate ownership states. So it so happens that those, what we would call politically purple states, right, have rates in the 30 to 40%, and does having things like a child access law or some safe storage requirement impact suicide rates? And then related, did you look at that in your physician's conversation paper? And does that play a role in the extent to which those conversations might or might not happen? And the question about your picture here we'll have to save for another.
Okay, so thank you, Jennifer. Those are great questions. With respect to the physician questions, very few people report ever having had a conversation. So the numbers get really small. And we couldn't look because of that, because it was such a small N, at whether these gun owners, they're not, this is not what we didn't find out is what about people who are not people who don't live in gun owning homes. This was only among gun owners. We didn't survey those who live in homes without guns. And so it may be that in states where there are fewer guns, people feel freer to speak about this, and you are being asked about gun ownership and counseled in the very states in which it's less likely that you own guns. We don't know, but that's a really good question. Your first question had to do with whether in what you call purple states, and you're speaking politically there, whether we looked at suicide rates in those states in relation to gun ownership?
My question really, I mean, I'm saying purple. I looked at your grouping, your high gun ownership states, and most of those in a political or social context, the residents would self-describe, they'd be more red states, right? They more people identifying as conservatives and identifying as Republicans. Low gun ownership states in the Northeast are very much in the what is typically considered blue. The states like Maryland, Delaware, Florida, Ohio, Michigan, Pennsylvania, which politically we call purple often because they vote in both directions, also have the gun ownership state rates that are in the middle of those two groupings. And so does political or social context, I was wondering, impact suicide rates in those gun suicide rates in those states, I guess would be my question.
So here's what I would say is just go to the individual level data. Look in the case control studies. They're done in different communities. What determines whether you live or die, the likelihood you're going to die by suicide, is determined by whether you live in a home with a gun. It doesn't matter whether you're a Republican or a Democrat. Republicans are more likely to own guns. But if you look within a given local area, the people who live in homes with guns are just much, much more likely to die by suicide than the people who live in homes without guns. And so these questions are excellent, but it's not as though Republicans have higher rates of suicidal behavior or major depression.
Right, but I was wondering, I guess, if the state laws.
Oh, yeah, the state laws. That's a good question.
Right? It's not actually, there's a political and social context in which this is taking place, but it's not a political question, if that makes sense.
Yeah. So with regard to the state laws, there are no gun-related laws that have ever been demonstrated to do any harm. And certainly with respect to suicide, there's just no logical pathway for them to do harm. But there have been many studies published in really good journals that have used fatally flawed techniques like cross-sectional evaluation of handgun to purchase background check laws, or of waiting periods, or of child access prevention laws and whatnot. And so those are completely uninformative, and yet they will be quoted as having unbelievably large benefits. But they don't, because the way to find out whether a law works or not is not to ask, are the rates higher in places that have passed the laws compared to places that haven't? It's to look before the law and after the law and see if the law changed anything. And as you were, I think, anticipating, places where there are lots of guns, like Louisiana, Montana, Alaska, are more conservative and are less likely to pass laws that restrict access to guns. And places like Massachusetts and Connecticut, which are more liberal and have fewer guns, are more likely to pass the laws. And so whenever you look at cross-sectional studies that say places with laws compared to places without laws, and look, suicide rates are much lower in places that have these laws, those are totally confounded by the fact that the places like Massachusetts and Connecticut, which pass these laws, have far fewer guns. And it's the fewer guns, it's that is responsible for the differences in suicide. We did a study recently that I didn't talk about here, in which we asked people whether they thought they lived in a state with child access prevention laws. The only law, right, that the Rand Corporation said has anything like sort of moderate level support for in the empirical literature. And what we found was that more than half of the people who were asked, do they live in a state with child access prevention laws, said, I do not know if I live in a state with a child access prevention law. Only a third of those in states with, and about 20% of those in states without these laws, thought that there was a law in their state. And when we compared how people store their guns in states with laws compared to states without laws, after adjusting for differences between those people who live in the Montanas and whatnot, where they don't have these laws, and the New Yorks and Connecticut's where they do, we found no difference in the way they store their guns. And when we asked people in this survey, this same survey that gave rise to Dr. Solly's paper and Andrew Connor's paper, we asked them, have you changed the way you stored your guns over the last 5 years? And if so, why? There are several hundred, 300-ish people, something like that, who said, yeah, I changed the way I stored my guns. And when you looked at the reasons they gave, there were 2 people who said, because of laws. And both of them did not have children in their home. And so you have to ask, I mean, there are plenty of good reasons to pass these laws, but it's the marginal effect on gun ownership and access to guns that these laws can have. You have to bear that in mind when you're evaluating the effect size, the benefit that you can expect from these laws. I would love it if there were such an easy answer as just pass these laws. They're not doing any harm. There are good reasons to do it. But if you're going to pass the law, you need to do what really changes the risk, which is educate people as to why you're passing law in the first place. There's good science to say that if you've got a gun in your home and it's accessible, you're increasing the risk of suicide, in this case, to everyone in that household. And make the argument for them to get the gun out of the house, make it inaccessible, rather than relying on a law that no one has enforced ever, and it's not observable when you're violating it. There's a child access prevention law. Half of the people don't know that there is one, and even if they know that there is one, no one can observe whether they're following it or not. And so you really have to ask, what is the goal here? If the goal is to reduce suicides, you need to get the gun out of the house most of the time. And that's certainly true when you're talking about sort of, for example, veteran suicides. If you're handing out gun locks and thinking that that's going to produce big savings in lives when the gun owner is the veteran himself, and you're saying out of one side of your mouth, you will be able to use your gun in self-defense if someone breaks in, and out of the other side, oh, this gun lock is going to protect you from yourself if you're suicidal, it makes no sense. And we need to approach what we would wish to be the case, that these laws have magical, large effects, with some sense of humility, because there are things we can do that that are harder that we should be pursuing with more resources and more vigor.
Thank you for that exchange. That was really interesting. We are at time. In fact, we are 1 minute over time, and I want to be sensitive to everyone's afternoon schedules. So thank you, Dr. Miller, for this really great presentation. I guess I will just say thank you on behalf of the GVP RIG and InCHIP, and I look forward to continuing this conversation. Amy, did you want to, I see Amy has joined. Did you want to say anything, Amy?
No, I was just going to say thanks for a great and provocative talk. This is not my own area of research, and it's always so disturbing when I hear these statistics and realize there's much more we could be doing in this space to prevent kids and adults from getting themselves in trouble here. So thank you for sharing that work.
Thank you so much for the opportunity. I appreciate it.
Take care, everybody.